Hello, Mr. Kulai. Good to see you again. Please take a seat. Sorry I'm running half an hour late today.
Yeah, no, it's okay, don't worry. Yeah, so... Yeah.
What's been happening with your symptoms?
Yeah.
Because you had quite a bit of pain, burning sensation after eating, acid in the back of your throat, worse when you lay flat, worse after alcohol. Is that all kind of, am I remembering correctly?
Yeah.
Great. And that all sounds to me very much like acid.
Okay.
I think you had a few concerns that it might be to do with your heart, but I hope I put your mind at ease. There's one thing I wanted to do, was I wanted to get the stool sample, okay? To make sure there wasn't a bacteria that was causing the symptoms you were getting.
Okay.
But what happened was you submitted a urine sample.
Urine sample,
But it was meant to be a poo sample.
Oh.
So the urine sample, that didn't help, and then you didn't pick up the prescription.
Yeah.
So we kind of haven't really moved on as I would have liked to, but it's not a problem.
All right. So I don't need to fast for this one, huh?
No, this is just a poo sample.
Yeah.
But
poo sample? What's that? It's poo.
So you need to poo. That's where all the problems started.
Okay.
You gave me a urine, a pee sample, but I needed a poo sample, okay, a stool sample. So yeah, feces. That's what we need, because that can tell me whether there's bacteria in the stomach. Sorry, I wasn't making that clear.
Okay.
All right,
No
so
problem,
that's the key. That's the key. I'll be upset if we get another urine sample.
No.
Blue for poo. Blue. Easy to remember.
Okay.
All right, just say Wow. That is pretty clear cut. So that tonsillitis is so bad, you definitely need antibiotics. I mean, that's a clear cut case. So if any one of your friends asks you, doctors don't like to get antibiotics, that's the kind of classic case where you need antibiotics. It's pus, it's very swollen, your glands are clearly up. If those tonsils get any bigger, like if you actually find that, you get a kind of that kind of noise, any hint of a noise like that, you have to take yourself down to A&E.
Does the fact of smoking affect it?
Smoking's not going to help it one bit. Had any thoughts about quitting smoking at all?
Yeah, I'll try it for a week.
You tried it for a week. How many would you smoke a day?
20 a day.
20 a day. Before you're 30, if you just stop now, that's £26,863. How much pleasure does smoking really give you?
Calms the stress.
Not as much as a £26,000 holiday, all expensive paid.
Yeah, but that's like in 10 years, though.
Well, but it's still real. How does it affect you? Like, are you aware of it? Are you conscious about it, or does it not bother you?
Doesn't bother me.
Doesn't bother you? Okay, good. I don't know, did my colleague tell you it's called pityriasis alba?
Yes.
Yeah. With this type of pityriasis alba, unfortunately, there's nothing that we really know kind of makes it better or worse.
Maybe antibiotic, maybe.
It's not anything to do with a bacteria or an infection or anything like that. It's getting better, and hopefully at some point it will be gone. What I will do, I'll give you a tiny little bit of hydrocortisone, 1%.
Okay.
And you can put it just on these patches around there, not around the eye because the eye is very thin, but just for 3 days, just once a day, just for 3 days, and then don't use it again, and just see if that makes any difference. Some people say it does. Any other questions? Is there anything that's worrying you at all?
Anything question? Just put it. Soak. No.
Are you interested in anything to do with those leaflets? Your mum will be even more worried.
I need them.
Do you?
I want to read it.
Are you just reading out those for interest, or is there something you want to talk to me about?
No.
You sure? All right, okay. Well, the door's always open if you ever want to come back and talk to me about anything from my broad selection of information leaflets.
But you know about that?
Yeah, I think so.
You'd be surprised how frequently patients will come in and they won't actually tell their doctor why they're there. And it's really important that we know about that. And we do have a term for it. It's called the hidden agenda. Essentially, your main tool for everything is listening, and there will always be cues.
So you basically just tick that box and hand it in. They'll put Telus off and just hand it in. Okay, when you need another one.
Also, the body language. If someone looks uneasy or they're avoiding eye contact, you just pick up on things.
Nice meeting you.
Thank you.
Take care.
Bye.
Do you want to talk to me about it?
No, I just need it.
Can you just give me 1 second? I'm going to ask your mum. Do you mind if I have a chat with you alone for 1 second? without your mum. Would that be all right? Do you mind if I just have a quick chat with Semi-Solo alone, just for 5 minutes?
Okay.
Yeah?
It's really important that young people and children feel able to speak openly to their GP, and sometimes that'll be about things that they certainly wouldn't want to speak openly about with their parents, for example. And I think it is important sometimes, even if someone is, say, under the age of 16, to have a moment of privacy.
So, the ones you were looking at were these two. What was it that made you think that you might need some of these?
I don't need them, I just need to get something. I can't reach it.
What do you mean get something?
I dropped something
Whereabouts?
in the heater.
And you want one of these?
I need to get it. I've dropped my 50 pin, I need to get it.
Okay, so you don't need anything, you don't know what these are all about, and you don't think you need what these are?
Just grab them.
All right, okay.
But obviously, yes, sometimes our intuition isn't spot on.
Well, you know what? I'd rather you didn't use my information leaflets to get your 50p. Maybe try a ruler. Do you have a ruler at school?
Yes.
Maybe use your school ruler or something like that.
Hello, Dixie.
Would that work?
Yes.
All right. By all means, have that. Okay? Take care. So, last time I saw you, you had this problem with your toe.
That's right. And I went.
And I was a bit worried about it. I asked you to get some blood tests to check for diabetes. And I'm sorry to tell you today that your blood sugar results did come back very high.
Very high. Oh,
Okay?
Yeah.
So
It's looking like diabetes.
I'm afraid so. In fact, I'm certain you have diabetes. Diabetes is a serious diagnosis
Yes.
because it's such a wide-ranging condition. The fact that the sugars affect your eyes,
Cool. Yeah,
affect your
yeah,
kidneys,
yeah.
and diabetes is in itself a risk factor for heart
Yeah.
disease.
Right.
Yeah, it's not something to be taken lightly, but at the same
course.
time, at the age of 60, we've got lots of years, hopefully, to get in control of things.
Type 1 diabetes is a failure of the body to produce insulin, which is a hormone that regulates your blood sugar levels. And type 2 diabetes is a resistance to insulin. So the insulin that you do produce doesn't have the same effect. Undoubtedly, type 2 diabetes is a serious diagnosis, but there aren't many conditions where the patient themselves has so much control over how things will progress and reduce the chances of serious things happening massively.
Now, the way we go about treating that is, first of all, we give some tablets. Probably the biggest thing is the things you do in your lifestyle, so diet is absolutely key.
Yes. Plus, I'm a drinker, so will that be knocked on the head or
What do you drink?
mainly lager?
Okay, I was worried you were going to say that. So, I mean, alcohol in general isn't going to help you.
No, of course not.
But all these alcohols have high sugar content, especially
I
a pint of
thought that.
lager.
I thought that. Yeah.
Okay.
I can still work though, can't I?
What do you do for a living?
I work on the construction sites
Yeah, so...
because that's my living. I need to get money.
Yeah, having diabetes is not going to stop you from being able to work on the site.
Yeah.
But you need to also be aware of just what's happening with your blood sugars because, I mean, we're talking about the rest of your life, 30 odd years.
Sure, yeah.
We need to get this diabetes under control, and that will take you time to manage your diet and to figure out what's bad, what's good. Actually, that's all you need from me in terms of paperwork for now. I'm going to give you a prescription now as well.
Right.
We might need a couple of different tablets to get your sugars under control. Hi, is it Miss Strong? Hi there, please come in. What can I do for you?
I'm here about my coil.
Okay.
That I've had in over 5 years.
Okay. Were you hoping to have it taken out today?
No, I want to keep it in.
Oh, right, okay.
If I can.
Fine. I think, to be honest with you, if you've had it in for 5 years, it's better to come out.
I've been fine with it. I've had.
Fine. I
It
mean,
wouldn't cut.
the last set of blood tests that they did suggested that you might be postmenopausal now, and at 53, I would expect that to be the case.
Between post.
So, as in, your periods might have stopped now. So, rather than leave this in for a long period of time, more than the recommended time frame, my gut instinct is it should probably come out.
I've had the menopause.
That's what the blood test would indicate.
I haven't got no hot flushes or anything.
Not everyone does get hot flushes. Not everyone finds it difficult. But that is some people. Yeah, the menopause affects people in various different ways. Was there anything else you wanted to ask about? Was that it today?
What's this? I noticed that I keep having, my vagina in there. You know that bridge bit, it keeps splitting now and again.
Okay.
Like a paper tear.
What, rough drawing, where are you talking about? Is it the back passage or is it actually the skin of the vagina?
Right on the muscle bit in the middle there. Like a little paper split.
Okay, and does it bleed?
No.
Is it just very sore?
Mm.
Okay. Well, that might all correlate to the fact that you might be postmenopausal now. You can get vaginal atrophy postmenopausally, where because you don't have the estrogen going around, the vagina will actually get a bit dry and actually can shrink, and you can get problems there. So I think this is all kind of part and parcel of the same picture, really. My gut instinct is that we take the coil out, we can start giving you some estrogen cream for the vagina that should keep it supple and avoid getting further kind of tears or irritation and things like that.
Yeah.
Does that make sense?
Yeah.
All right.
Yeah, basically what it is, look, I'm a diabetic, and my levels have been quite high, and I think I might have a urine infection.
All right. How high is high on your sugars right now?
22.3.
Okay. And where do you normally sort of run at?
Well, normally they run at about 5 or 6. I mean.
Yeah. So they really have shot up.
Yeah.
You've had quite a few urine infections. Is that right?
Yeah, on and off. Yeah.
Okay.
Yeah.
What are the symptoms you've been getting?
Just like a burning sense,
It burns.
Yeah.
Okay. And are you peeing more often than
Yeah,
normal?
more often. Yeah. Just continuously all the time.
Right.
Yeah.
Okay. Have you seen any blood or anything in
No,
it
it's
at all?
not blood.
Right.
It's not blood.
Any cough or
No.
difficulty breathing, headaches,
No.
rash?
No.
Nothing else like that? Diarrhea?
No.
Bowel habits fine?
No.
Okay.
Yeah, they've been all right.
I think the first thing I'll do, if you don't mind, is just dip the urine.
Yeah, sure.
Wait, take it from there. Okay.
Yeah.
There's a lot of glucose in your urine,
Yes, sir.
but there isn't much evidence that there's a nasty infection going on. You shouldn't really get a significant burning sensation from just sugar, but I think going to the toilet a lot, going to the toilet very often, is classic of your blood sugar not being very well controlled and being much too high right now. I think we need to get your sugars better controlled, and I think that's going to mean cranking up the insulin slightly. I think we should go to 12 in the morning and 10 in the evening. And I think we should see you early next week with the results of the urine sample to make sure we haven't missed any infection. Although it doesn't, I don't think that's what's happening.
No.
All right? Okay.
Okay, yeah.
Take care.
Okay.
Nice meeting you. And if you were going to score it, say 10 being the worst pain in the world, like having your arm ripped off by a lion, and 1 being like bitten by an ant, how would you score it?
10.
This pain in your stomach is as bad as having your arm being ripped off by a lion. Come in. Hi, Mr. Lemon, good to see you. Sorry I kept you waiting such a long time.
Is it possible to get a glass of water, or I feel a bit faint?
Yeah, sure, take a seat.
Something really light-headed.
Not a problem, you take a seat there, I'll be with you in just a second. I've got a patient with me, but
Oh, right.
you can bring him in if you
OK,
like.
I'll move them into my room and then I'll come into your room when you're finished, all
Okay.
right?
I feel really peculiar all of a sudden, I don't know why.
Have you been feeling like this all day? Is that why you've come to see me, or is it just happened now?
No, it just happened out loud. I just come over and I feel like light-headed.
Okay. Ever had an episode like that before?
No.
Ever fainted?
When I cough too much, I faint. I pass out, which has happened, I don't know how many times, but...
Any feeling of your heart's racing at all?
No, but I'm getting all hot and I feel a bit sweaty and cold and I don't know.
Okay.
Very odd.
Do you mind taking your jacket off in a minute so I can just check your blood pressure? What was it that actually brought you here to see me today?
I'll need my doctor's certificates run out and I need Some of my tablets. Oh, sorry, I feel really strange.
Just relax. Okay, just roll your sleeve up for me. Okay, do you mind just standing up for me? If you stand like that, you do?
Yeah.
And is it a definite dizziness, or is it the actual room spinning?
I feel lightheaded. I don't know. I can't really explain it.
Sorry, let me just get this.
I've been sleeping funny as well. I haven't been sleeping too well.
Do you find yourself falling asleep? Like at times when you wouldn't expect to fall asleep?
Yeah.
Do you mind just sitting on the edge of the bed for me? And anything else changed in your life over the last couple of months?
No.
No? Got into any bad habits? Drinking too much, or...?
I do drink beer every day.
How much alcohol do you drink?
About 5 cans, 5, 6 cans.
5, 6 cans. Of what kind of drink?
Stella.
Stella. So that's, what is that, 5.4% or something?
5.
5%? Yeah. Okay. Would you consider that too much alcohol? Do you know that's bad for you?
Yeah, no, it's too much alcohol.
How long have you been drinking that much, do you think?
I don't know. A long time.
6 months? A year?
More than that, probably about 8, 9 years.
Do you drink alone?
Yeah.
Okay. And do you live with anyone else?
No, by myself.
Okay. Do you mind just sitting down, lying down flat for me?
Yeah, there's a little bit of pain there.
There?
A little bit.
I think, if I'm honest, I think there's a few factors. Did you have 5 lagers last night?
Yeah.
I think if you've been drinking 5 lagers, cans of lager every night for 9 years, you've done damage to your liver.
Yeah.
Giving bad news to anyone isn't an enjoyable part of the job, but unfortunately it's something you have to do on a regular basis, and there's no beating around the bush. You have to be completely honest. It's definitely a regular part of the GP's job. If someone drinks that volume every day, you can't just suddenly stop because you can get into problems with withdrawal. But you certainly do need to cut down, and that might be changing the routine from 5 drinks a night to 4 drinks a night for a period of time, down to 3 drinks a night, and take it from there. I can't tell you that you want to stop, but if you feel like you're ready to stop or you want to think about cutting down, these are the people that are going to be able to help you. I mean, does that sort of scare you, or does it stress you out, or what are your thoughts on what we just spoken about?
Yeah, it does kind of scare us, because I know I'm drinking too much. But I think it's just because I'm always in my room, my bedroom. I never go out, I never do anything. My legs always get given away, or one day it's okay, the next day it's not. I think it's just that, because I've been like stuck in the house for like nearly 2-3 years now. You know, not being able to do anything except go out now and then, but not as much as a normal person would opt for my age.
I'm sorry you had a tough time lately, but I'm glad we've kind of stumbled upon it almost by chance, because it means that we can got the opportunity now to try and improve your situation a little bit, not just with your health, but also with, you know, how you feel in yourself and your outlook in life in general, really. Our priority now is to get the blood test done, sort out, see where we are with the liver situation. But next time I see you, hopefully you'll be able to tell me that you've cut down a little bit, and then we can take it from there. Sorry to keep you waiting such a long time. Please come and take a seat.
Okay.
So it's been I think I last saw you in December.
Yeah.
When you just got out of jail.
Yeah.
And how have things been going for you over the last few months?
Oh, last month's been more down and up, getting low again, getting very depressed. I don't know.
All right. Sorry to hear that.
You get to a point you don't want to do nothing, like, you know what I mean? If I'm talking to someone, and the first thing that would come into my head is how can I get out of the conversation without talking to them? And sometimes when I talk, I have panic attacks and that, like, you know, I just burst out sweating and things, like.
Well, last time I spoke to you, we spoke quite a bit about your mood, and you were quite optimistic that things were going to be all right, having got out of jail. Have you been slipping into any of the other sort of bad habits?
No, I haven't been using drugs and it's just stable on my methadone and that, but because I've used drugs a lot in the past, and, you know, when I speak to doctors, I think they think I'm lying sometimes. Does that make any sense to you?
Lying about what?
About the way I feel and that. I don't know, it's just the way I am.
Did you mean specifically about people might think you're not depressed?
Yeah, that's what I mean more than anything, yeah. But
it's not our job to cast judgment or really make those kind of assertions. I have to take what all my patients, regardless of their background, what they tell me, I take at face value.
No, I understand that.
You do have a mental health problem.
Yeah.
Lifestyle change is not easy for a patient to do, and nowadays a lot of people just want a tablet, they want medication, they want sort of recovery to be something passive, but unfortunately it's just not an option. So I think it's really important to give patients time, find out what they understand about the situation, and make sure there's some kind of plan for them to come back and talk to you about it.
When I last spoke to you, you didn't think that you would ever do anything. I mean, we spoke about suicide and quite some dark things as well.
Yeah.
Are those thoughts that is still not the sort of thing you'd act on, or?
No, I'm not brave enough to do it, if that makes any sense to you.
Are there any other protective factors that you think, other things that stop you? Do your mum or your son come into your thoughts as well?
Only family really now, yeah.
Mm-hmm.
Do you know what I mean?
I'm glad you don't have the courage to do anything.
Yeah.
But if that ever changes, if you suddenly start thinking you're so low that you think you are going to act on those thoughts, it's vital you come and talk to us. Okay? And if you go and get in touch with us, you need to pick up the phone and talk to Mind. They've got a good helpline, or the Samaritans have got a helpline. If that's not working, you have to go to A&E because they've got trained psych liaison nurses who are there for that sort of discussion.
I know that,
Okay?
yeah.
And I started you on some tablets as well. Do you take them every day?
I do, yeah.
Okay.
But I haven't taken them for the last 4 or 5 days because I ran out.
It is really important with these kinds of medication that you build up slowly and you don't suddenly stop.
Yeah.
Well, a big part of it is being a bit organised about your medication. Because sometimes when you're feeling low, you lose the motivation to stay organised. But actually, when you're feeling low, you need to be more on it. When do I run out of tablets?
Yeah.
When do I see the GP next?
Yeah.
So I'll give you some more of your medication. To be honest with you, you've only been out of jail for a couple of months, and from my point of view, whenever I see you, I think you're doing pretty well for yourself. And staying out of the drugs and the alcohol, which got you in that situation in the first place, is the main priority.
All right, thank you very much, Doctor.
Take care.
Okay, have a nice day. Thank you.
Bye-bye.